Hello guys, welcome back to another video. Welcome back to pregnancy series. So today we are going to look at, now we had already looked at preconception care. This is care you take before you get pregnant. Now we are going to look at antenatal care, what it entails. What after getting pregnant, what will you expect during this pregnancy? So I'm going to look at some of the signs and symptoms of pregnancy, body changes during pregnancy, danger signs during pregnancy, so many things I'm going to look at in this video. Please, so just stay in, what am I saying, continue watching this video up to the end. Yeah, so let us look at some of the signs and symptoms that will a patient or a client that is maybe you are getting pregnant for the first time and you don't know even all these signs. So the first sign will be you will miss your period. If you are somebody who usually have a regular period, or maybe if you usually don't have a regular period, if you miss period more than 2 months, then you're supposed to go and check. You can be pregnant, or you might be having another problem. So the first sign is missed period. I'm just going to highlight them because I did a video on this explaining the reason why some of these signs will present to a pregnant woman. So the first one is missed period. The second one is drowsiness or headache or fatigue. The next one is irritability or mood swing. You can have insomnia, or you can have you can sleep a lot. We have nausea and vomiting. Also, we have changes in the taste. You find that the food that you used to like, now you don't like them. And we also have constipation. You can also have heartburn. You can have breast swelling. You can have darkening of the nipple. Yeah, the darkening of the nipples. And also you can the abdomen can start protruding. Yeah, the abdomen can start increasing in size because the baby is growing there. Those are some of the signs that a client, someone is pregnant, is not a patient. A client will present with in the early stage of pregnancy. Maybe you did not know that. Now I think you know. Now let's look at some of the changes that will take place when you get pregnant. Some of the body changes that will take place when you get pregnant. So let us look at some of the changes that will take place, physiological changes that will take place when a woman is already pregnant. So we will look at we'll look at it according to the system. We will look at it GIT, according to system. So I will start with so you get that usually there are physiological changes that usually take place and anatomical changes that also occur during pregnancy. These changes may be systematic or oral. So most of the system changes return into pre-pregnant state after 6 weeks. And then these changes occur during pregnancy to maintain a healthy environment of the fetus without compromising the mother's health, and also prepare the process of delivery and care of the newborn. So changes that will take place, you will get that in the GIT. The GIT, that is the gastrointestinal tract. There will be increased appetite. The woman will tend to eat a lot, and also the woman will tend to rest to conserve energy if this person is not eating much, because you may get some people have a lot of vomiting and then eating, or may also become a problem. So this person, the pregnant woman, may have a lot of appetite. to help in to get a lot of nutrients so that the baby can grow well. Also in the GIT there will be dilation. You will find that a pregnant woman is throwing saliva most of the time, and that is just a form of how the body is adapting to accommodate the fetus. So another thing that will also happen in the GIT, the gums will bleed and swell. Some of them will bleed and swell. That is why when you are pregnant, sometimes when you had a problem with your teeth, when you are pregnant, the problem can become worse. So this is because a lot of blood is pumped on the gum, and the gum swells, and sometimes maybe they may bleed. Also, the woman will suffer from constipation because maybe of lack of exercise, also because of the slow peristalsis that is happening. Okay, I was saying that peristalsis will also be low, and the woman can suffer from constipation. Yeah, those one are also heartburn because maybe this one the what, the fetus is pressing the stomach, and now the stomach content is can tend to come out or regurgitate. Yeah, so that is what will happen in the GIT. Some of them I will not say because yeah, some of them. The woman can also have irritation with the bladder because of the fetus can also press the bladder, and the woman will tend to have irritation on the bladder. Also another thing that will also a lot of blood will be needed for the baby to have what? For you to have a healthy baby. Those are some. There will be linea nigra, those lines that also that usually appear on a pregnant woman, linea nigra and stria gravidarum. Those are lines that usually tend to occur or to appear when you are pregnant. Those are some of the changes that will take place. Those are just some of the changes that will take place when you are pregnant. There are so many in the kidney, in the system, in all the systems. Okay, what am I saying? In all the system, there will be some changes to accommodate the fetus and also the baby to have a healthy environment. Yeah. So when you are pregnant, some of you doesn't know what is expected of them to do when they are pregnant. The first thing you are supposed to do, you're supposed to get good nutrition. I will talk of some of the food. That will be a specific video because it is a topic on its own. So you should have a balanced diet. You should rest enough. You should rest enough. At the same time, you should have some of the exercise. You should take your iron, folic acid. You should go for vaccination if you're somebody who is still under those vaccinations. You should protect yourself from getting malaria by sleeping under treated mosquito net. And also, if you are coming from a malaria zone, you are supposed to take prophylaxis of malaria. Another thing you're supposed to do, you should also maintain hygiene. Because some people when they are pregnant they look like mad person, so you should maintain hygiene, personal hygiene. Also personal hygiene, I mean head hygiene, eye hygiene, oral hygiene, the whole of your body. Personal hygiene, you should maintain personal hygiene to avoid infection. Another thing that you are supposed to do when you are pregnant, you should come for your antenatal clinic the way you have been told. You are supposed to know some of the danger signs that may happen when you are pregnant. Like, because I already did this, I will just highlight. when you maybe you are having epilepsy or convulsion, you're supposed to come to the hospital. When you have vaginal bleeding, you might be having placenta abruption or placenta previa. I will talk about them in one of the video. You're supposed to have you're supposed to do what? Somebody is disturbing me. Okay, I was talking about the danger signs in pregnancy, that is convulsion or convulsion, vaginal bleeding. I was also you can also experience severe headache. You can also experience those are some of the danger signs. Don't confuse. Don't get confused. Okay, yeah, when you have severe headache, that is one of the danger signs. If your water break before term, you're supposed to come to the hospital. If your body swell, your face, your feet, if you have a swelling that is abnormal, because you know a pregnant woman sometimes you have the lower limb edema, but if now it's extend up to the face, the abdomen, the upper limbs, then you should come and see the doctor. I've talked about severe headache. If you also have severe abdominal pain, those are some of the danger signs that should alert you, and then you're supposed to come to the hospital before it gets worse. Yeah. So also there are some of the medical conditions that you might have when you are pregnant, and these maybe you can have diabetes in pregnancy, that we call the gestational diabetes, preeclampsia, or hypertension in pregnancy. You can have anemia in pregnancy. I will talk about them in details. So you're supposed to know signs and symptoms, so make sure you watch all these pregnancy series. Make sure you watch them, because we have a lot to talk about. Today I was just to tell you what you're supposed to know during your antenatal clinic. You're supposed to start your clinic as early as you realize you are pregnant. You're supposed to start your antenatal clinic, because if you don't do that, you will start taking your iron folic acid late, and then your baby might have congenital abnormalities. You might suffer anemia in pregnancy. You might suffer other conditions in pregnancy if you don't start antenatal clinic earlier. So during antenatal clinic, whatever you are expected to do, or the care you are expected to get, I think I've talked about them, about the nutrition, exercise, taking iron folic acid at the right time, and taking them every day, attending your clinic as you have been told. Ensure you know that the danger signs during pregnancy, among other things I've talked about. So thank you for watching this video. Let's meet in another pregnancy series. Bye till next time.